Hello.
Hello, my name is Jonna Warden. I'm a nurse practitioner student, and today we're going to be doing a full head and neck exam. Does that sound all right?
Yep.
Okay. Can you confirm your name and date of birth with me?
Tristan Kyle Warden, January 26, 1996.
Alrighty, so here for general survey, we have a 29-year-old male. He appears to be comfortable and in no distress. He is sitting in upright position and is dressed appropriately for the situation. He is alert and oriented ×4, and he is the primary historian for his care. Vital signs include blood pressure 132/80, heart rate 82, respiration rate 18, temperature 98.1. He is 6'1" at 300 pounds, and he rates his pain at a 0 on a scale of 1 to 10. Now, at any point in this exam, if you have any questions, please let me know. All right. So first, I'm just going to take a look at the overview of your face. I don't see any bruising, swelling. Everything looks asymmetrical. I don't see any lacerations or any acne. And I'm just going to feel your skull. I'm feeling for any depressions, any lumps or masses. I don't feel any here. Now I'm going to just take a quick peek at your hair. I don't see any hair loss. Hair looks evenly distributed. I don't see any nevi or nits, and I'm just going to do a quick tug test. No hair falls out when we do the tug test, and the texture of his hair is thick and soft. While I'm here at the forehead, I'm going to feel for his temporal pulses. I can feel his temporal pulses equally on both sides. And I'm just going to take a quick listen to him. Good. Good. And I don't hear any bruise when I listen there. Next, I'm going to look at your eyes. The eyes are symmetrical. The eyelids are symmetrical. I don't see any crusting, redness, or swelling. We're going to take a quick peek up. Just look straight ahead for me. Good. 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 Sclera is white. Conjunctiva is pink. Next thing I'm going to do is the peripheral vision test. Now I want you to tell me when you can see my fingers, okay?
No. No. No.
Good. Next I'm going to check for any extraocular movements. I just want you to follow my finger with your eyes, okay? Don't move your head. Just look straight ahead. Good. 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 I want you to follow in. Very good. All right, next we're going to just check your pupils and take a peek inside your eye with the ophthalmoscope. I'm going to check your pupillary reflex. I just want you to look straight ahead right here. Good. Good. Pupils are round and reactive bilaterally. Now I'm just going to take a quick peek inside your eye, okay? I want you to look straight ahead for me. I apologize in advance. I'm going to get really, really close. Good. Look straight ahead for me. Good. Open real wide. Good. Good. Inside the eye, we can see the macula. We can see the optic disc and the optic cup. Everything looks normal in there. I don't see any AV nicking, any engorged blood vessels, anything along those lines there. Next, we're going to check your visual acuity with a Snellen chart here. I'm going to have you cover your right eye for me. I'm going to move back 6 feet. And so this is going to be the vision in your left eye. I want you to tell me the smallest line you can read.
LT, FP, H.
Perfect. So in your left eye, we are 20/30. Go ahead and cover your left eye for me. In your right eye, please.
LT, FP, H.
Okay, good. So we are actually going to be 20/20 in both eyes. I was wrong when I said 20/30 the first time. So we are 20/20 in both eyes. Next, we're gonna move on to your ears. I'm gonna change my my ophthalmoscope to an otoscope here. First thing I'm gonna do is I'm gonna pull on your ear, and I want you to tell me if there's any pain when I do so, okay?
No. No.
Good. Check the other side.
No. No.
Okay. When I'm looking at the ears, I'm looking for any redness, drainage, swelling. I don't see any of that in there. Now we're gonna assess your hearing. I'm gonna do a quick whisper test. So I'm just gonna whisper a common phrase, and I want you to tell me if you can hear it and repeat it, okay? Baseball.
Baseball.
Good.
Basketball.
Good. Next, we're going to do the Rhine and Weber test. These are to detect any hearing loss. I'm going to put this on top of your head. I'm going to strike it, and I want you to tell me if you can hear it equally in both ears.
Yep.
Good. Now I'm going to do another test. I'm going to put this on your mastoid bone. I'm going to strike it. I want you to tell me when you stop hearing it, okay?
All right.
Can you hear it?
Yep.
Good. Do it over here.
Right there.
Can you hear it?
Yep.
Good. Now while we're here on the outside, I am going to check for your preauricular and your postauricular lymph nodes. I'm just going to feel right here. Good. All right, now I'm going to take a quick peek inside your ear with my otoscope. We're going to pull up and back on your ear here. Okay. Good. I can see the tympanic membrane. It is nice and pearly gray, not bulging. Check on the other side here. We do the same thing over here. Again, tympanic membrane, nice pearly gray color, no bulging, no redness inside the ear. Next, we're going to start with your nose. Next, we're going to do the nose. I see your nose is symmetrical. I don't see any bruising, redness, any drainage coming out of it externally. I'm going to check the patency of your nares, so I'm just going to press on one of your nares and take a deep breath for me, okay? Good. Good. Now I'm going to clean off my scope here, and then we're going to do a quick nose exam. I'm just going to take a quick peek on the inside. Tilt your chin up for me. Good. Very good. I can see the turbinates. I don't see any redness or swelling. No masses or anything in the way there. The nares are nice and patent. And same on the other side. And while I'm here, I'm going to palpate your frontal and your maxillary sinuses. So if you have any pain, let me know when I press on them, okay? Any pain there? Any pain there?
Nope.
Good. Next, we're going to go into the mouth. I'm going to just take a quick peek in there with my light. Good. The oral mucosa is nice and pink. Lift your tongue up for me. Good. I don't see any masses, lumps, or swelling. All his dentition is intact, and his lips and mucosa look nice and moist. I'm going to throw some gloves on, and then we're going to take a peek, just a quick feel inside your mouth. Now also, when I looked inside his mouth, I noticed that his uvula was midline, and he also did still have his tonsils. You do have your tonsils. Yes, okay. Open nice and wide for me. I'm checking for any lesions. Lift your tongue for me. I don't feel any lesions, any indurations, and his dentition is nice and intact. You don't have any loose teeth, do you?
No.
Good. Next, I'm going to feel your neck. I'm feeling for any masses, any lesions, any tenderness in there. Any tenderness when I press?
No.
Next, I'm going to feel for your trachea to make sure it is midline. Trachea is nice and midline, and while I'm here, I'm going to listen to your carotid pulses. Good. Good. No bruise when you listen to the carotids. I'm just going to take a quick feel. Good. Nice and strong on both sides. And then next we're going to feel for your thyroid. Make sure there's no swelling or masses in there. Good. I'm going to have you take a little sip of water for me. Go ahead and sip, and I'm going to feel for your thyroid. Good. Good. We can feel for the thyroid. When he does that, like I said, no swelling, nothing, no tenderness when I press here. Okay, good. I'm just going to feel for some lymph nodes here. We already felt for your pre and post auricular, so if your submental, your preclavicular, and your postclavicular. Very good. And then I want you to just check for range of motion. So can you move your head around? Good. Go up and back. Any pain or any stiffness when we do that?
No.
All right. Well, that completes our full head and neck exam. Thank you very much.